The Westchester County Center was one of 3 state vaccination sites that opened January 13th as part of the rollout of New York State's plan for large-scale administration of COVID-19 vaccines. The Westchester Medical Center Network is providing clinical personnel to handle the processing of people who are eligible to receive shots of the Pfizer vaccine. The U.S. Army Corps of Engineers converted the county center and its adjacent parking lot into emergency hospital facilities as the pandemic's impact was becoming increasingly dramatic and there were fears that hospital capacity would be exceeded. The feared hospital overload in Westchester did not materialize, and the county center facilities went unused. New York State Department of Conservation Commissioner Basil Sagos, who had been involved in setting up state-operated COVID-19 testing sites and has been working on the vaccination effort, was at the county center for a media briefing.
We established the most robust COVID testing program in the U.S. This spring. I was there opening some of these sites and helping to operate them. And we conducted hundreds of thousands of tests every day, continuing to do so to this point. We are going to do the exact same thing with the vaccination program. Make no mistake, this is the largest government operation in our lifetimes, starting way back in March when this began, and certainly now into this most important phase, this vaccination phase. New Yorkers have been stepping up from every corner of the state. People have been masking up, people have been socially distancing. They've been giving us a chance now to get to where we are at these vaccination sites with this light at the end of the tunnel. These sites are the light at the end of the tunnel. We need the federal government to step up. We've needed that since day one, since March, and we have not gotten what we needed out of the federal government. We need the expansion of the vaccine effort to track what we are doing in terms of developing capacity. We have been expanding the population of those who are eligible for the vaccine based on federal guidance. We are increasing distribution points, but we're going to need more vaccines. We get 300,000 vaccines in New York per week. At this rate, for 7 million New Yorkers, it's going to take us 6 months to vaccinate everybody, and that's just for the current pool of eligibility. So we obviously need the federal government to step up in a significant way and help us get to that point where we can finally put this incredible pandemic behind us. Once you have your appointment, the rest is really simple. You show up at the right time, you get screened, you get your shot. The medical professionals then observe you after the shot for 15 or 30 minutes, depending on your condition. And at that time, you're signing up for your second dose. Then you're free to go, and then we'll see you back in a few weeks for your second dose. We ask for the public to be patient with us, right? We are building the plane while we're flying it. This is an incredible undertaking that none of us have ever experienced. We've built great systems. We've got thousands of people who are at call centers and behind the scenes trying to make this work. We just would encourage folks to keep trying to get an appointment. Don't lose faith. We're here for you. We've now built this system. We've built this network. We're waiting for additional supply from the federal government. We will get people vaccinated.